Okay, so today I'm going to be performing 2 injections, an intramuscular and a subcutaneous. Before we get started, I'm going to check the patient's MAR to make sure the medication and the dose that I'm giving is correct. I'm also going to review the 8 rates of medication, make sure it's the right patient, medication, reason, dose, route, frequency, time, and site. And I'm also going to make sure the patient has no known allergies to any medications. So for the subcutaneous injection, it's ordered that the patient receive 5,000 units of heparin. So for the subcutaneous, I'm going to use a 27 half inch needle. And for the intramuscular, it's 1 milligram intramuscular of Haldol, and I'm going to use a 23 gauge. So for the heparin, the patient will receive 1 milliliter, so I've decided to choose a 1 milliliter syringe. And for the Haldol, it's going to be 0.5 milliliters. This is the only one we have available, but I would use between 0.5 and 1 mil. So I've grabbed 1 mil vial of the heparin. I'm going to take the cap off and just sanitize the top of the vial. Dispose of that. I then have my needle and my syringe, and I'm going to attach the needle to the syringe. I'm going to remove the cap, not the needle, and I'm going to draw up 1 mil Once I've done that, I'm just going to make sure I get all the air bubbles out. And place the cap back on the needle. So I've now grabbed a 2 milliliter vial of Haldol, and I'm going to open up the syringe, attach the needle to the syringe, remove the cap before I'm going to clean the vial. And for this one, I'm going to withdraw 0.5 milliliters of the Haldol. Again, I'm just going to make sure I get all the air bubbles out before. Place the cap back on. And now I'm ready to go in. Prior to entering the patient's room, I'm just going to label and double check the medication again and dose with the patient and label each syringe. Hi, Mr. Mancini. My name's Mariah. I'm a level 2 nursing student with Conestoga and McMaster University. I'm going to be administering your subcutaneous heparin shot today and also your Haldol intramuscular shot. Before we get started, can I just get your name and your date of birth? Okay. So before I perform this subcutaneous injection, I'm just going to be checking the site and the patient for any circulatory shock and any issues with tissue perfusion. The patient looks fine and there's no issues that way. With a subcutaneous injection, it's going to be going either to the right or the left of the umbilicus, about 5 centimeters, and it's going to be going in at a 45 to 90 degree angle to get into the subcutaneous tissue just underneath the dermis. So Mr. Mancini, do you have a preference on which side I put the shot on, either your left or your right? No? Okay. Now I'm just going to palpate around the area, and if you feel any pain or tenderness, just let me know. Nothing? Okay. Now I'm just going to swab the area to clean the site. Alright, you're just going to feel a slight pinch. We're all done. I'm just going to discard the needle in the sharps container. And I'm just going to give that one last wipe. And there's no bleeding or anything like that, so that's good. So before I begin the intramuscular injection, I'm just going to assess the patient for any muscle atrophy, reduced blood flow, and any circulatory shock. I'm not noticing any issues right now with the patient. And just one other thing to note, with an intramuscular injection, the needle is going to be longer because I'm injecting it into the muscle. Okay, now Mr. Mancini, I'm just going to get you to roll towards me. And I'm just going to assess the area again for any reduced blood flow, muscle atrophy, or circulatory shock around the area that I'll be injecting the site. I'm just going to palpate along the area. Do you feel any tenderness or numbness? Any tingling? No? Okay. So now I'm just going to be landmarking where I'm going to inject the site. So I'm going to place my palm of my hand on the greater trochanter, my thumb towards the groin, my index finger towards the anterior superior spine, and then my middle finger down towards the buttocks to make a V shape, and I'm going to be injecting right in between those two fingers. Now I'm just going to swab the area. Take the cap of the needle off and pull the skin apart. And you're just going to feel a slight pinch. And there you go. And you can roll back over there. And I'm just going to dispose of the needle in the sharps. And I'm just going to clean that site one last time. A little bit, there you go. And you're all done. All right, is there anything else I can help you with before I leave, Mr. Mancini? No? Okay. Well, I'll be back in a little bit to check on you. And now I'm just going to mark off on the patient's MAR that I've completed the injections.